backward. What is the next priority action or actions? So you tell yourself the next has to do something, an action, either one or two actions, and it has to be a priority. A 45-year-old man was admitted overnight for pre-operative evaluation pending abdominal aortic aneurysm repair. So they admitted the patient. EKG was obtained and shown below, right? What do we do? This is what we're saying. So you have to analyze the questions. It's a selected apply. What would I do? Priority. Patient is getting surgery and we're doing preoperative evaluation to make sure the heart is fine. And you have this, right? And so you go through the basics, right? You go through your RR, and just by looking the RR, you look normal. The distance 1, 2, 3, 1, 2, 3 is all normal, right? So I know this is a sinus rhythm. I calculate my heart rate. This is fine. It's between like, you have 3 divided by 300. I see 1, 2, 3, maybe 4. You can even add 4. Yeah, it's less than 100, right? So I know this is a sinus rhythm and the heart rate is less than 100. I see a P wave after every QRS, P wave after every QRS. I look at the PR interval, it's less than 5, QRS less than 3. I have a sinus rhythm, a normal sinus with a heart rate fine. So you have a patient with the normal sinus rhythm, heart rate less than what? 100. 60 to 100 is normal. Therefore, what do I do? Patient there, his heart rate is fine, his EKG look normal. So this is a normal EKG. Therefore, we should not defibrillate the patient. Patient does not need CPR. He's not going to be happy about it. Patient does not need to be bolus. Do nothing and place the EKG in the chart. That's all, and the doctor can review it. So that's what you do as a nurse. So this is normal sinus rhythm, everybody. Most people have normal sinus rhythm unless there's anything wrong with the heart. And when you see this, you should not call the doctor. I mean, you just put in the chart. If you see anything worrisome, yeah, calling the doctor for this is a wrong move. You ask you, is it normal? Yeah. So this patient does not need anything. Put it in the chart and do nothing. Okay. Sometimes it's difficult for us not to do anything, but this is what you do. Okay. So that's the first question. Normal sinus rhythm. We got to start from there. Now, we have another patient. What is the situation? The same thing. Select or apply. You choose those that you're confident. If you know it, choose it so that you don't lose the point for these generation questions. What is the next priority action or actions? Okay, what is the issue? A 50-year-old client underwent uncomplicated laparoscopic appendectomy, bunch of ways. The rhythm was seen on cardiac monitor 24 hours post-surgery. So what would you do? You're breaking it down. What is being asked? What is your priority? What is the case? Patient had surgery and everything went well. 24 hours later, they saw this rhythm, right? What would you do? And you go back. You said, my RR, and see if it's sinus. I see if you measure from here to here, this look fine. It's all normal. The distance is the same. So I know it's a sinus rhythm, right? Then I look for my P. I calculate my rate first. I see 1, 2, only 2 big lines. This between the RR from here to here, there's only 2. And I can say that what? Or maybe you can add 1 to it. So you don't count the first one, 1, 2, 3. You can say, so there's 300. I'll just use the 2 because this sometimes it's an RR interval. So 200, 300 over 2. So I have like what? 150. 150. This is too high, right? This is too high. This look like, but I can see a sinus. I can see a P wave. I see a P wave. I see a P wave. I see a P wave, and every P wave is followed by QRS. But look at a QRS. There's no time for the T wave to finish. T wave finished the QRS, the P wave pickup. T wave finished PR pickup. And the distance, this is normal. the PR interval is so short, like there's no time. So this is fast rhythm, but I can see P wave, and I have a sinus rhythm. So this is the sinus tach. So sinus tachycardia. This is a very trappy question. It can trap you when every time for your boards, you see a sinus tachycardia, never treat it with medication. Until you don't know what it is, medication is the wrong answer. There's a reason why people's heart rate goes faster, and it's sinus tach. QRS is fine, the P is fine, the interval looks fine, except the rate is fine. I don't see any worrisome, the shape look okay. Sinus tach is always a manifestation of something bad is happening. So don't treat it with medication now. Number one thing you do is to find the source. What is causing the patient the problem? Therefore, medication is never an answer choice. It may be this patient just had surgery. They may probably be in pain. So you assess for pain. Or they are dehydrated. Dehydration is also a cause of sinus tachycardia. Patient just had surgery. So check their in and out, how much urine they pee, and how much fluid you've given them. It may be fever. Fever is a notoriously early sign of when somebody is going to get sepsis and they have fever, their heart rate goes up. So assess for fever. Number 3, amiodarone is a wrong choice. You don't know the problem and you're trying to break it down. So this is also wrong. So which one are the answers? 3, 2, 5. So there's 3 answer choice. If you pick 5, you get what? 0. If you pick 5, you may get 1, yeah, because you subtract 2 answers from it. But you have to pick those that you're confident, okay? So select those that you're confident. And then if you're confident about it, 2, just choose it. Okay, just choose it. But this is how you go through the EKG. So we've seen sinus tach, we'll be able to identify it, and we'll be able to look at the causes, infection, there may be also bleeding, that is dehydration. So infection, dehydration, pain, something is causing it, or they're having sepsis or bleeding. So these are all, you don't treat it with the medication until you figure out there is no other source, then you go back. So priority action does not mean treat it right away. You got to look for the problem. Okay, so that's the first. Second rhythm you should know, and the causes and the treatment. Number 3, same thing, right? The next anticipated plan of care include, so select or apply, right? What is the problem? A 35-year-old client present to the emergency room after threatening suicide. Client recently broke up with the spouse, right? And heart rate was 120, and subsequent EKG shown below. The next anticipated plan of care is this. So what is the question? What would I do? What is the problem? Somebody broke up with a boyfriend and girlfriend, came in tachycardic to 120, and you obtain this EKG, and you have this. What do you think? The same thing. Look for RR, and I can tell that this is uniform. Therefore, I know I have sinus. Then I calculate my heart rate. What is the heart rate? It's barely 2. So I know they don't telling me if this is 6 seconds. They're not telling me. I know it's not irregular. So since they don't tell me it's 6 seconds, I'm not counting all the hour. 1, 2, 3, 4, 5, multiply by 10. No, I'm just doing the big line between each hour. And it's almost 1.5. So 300 over 1.5 is greater than 150, right? So I know this heart rate is greater than 150. Like if you look at this one, it's 1. I mean, so it's like, it's greater than 150. So this is, and then I look at the P wave, you can even descend it. It's like buried with the T wave. It's too fast. The T wave, which is the repolarization of the ventricle, is now being buried with the, what do you call it? Atrial and depolarization. When you see that, that means there's no time for the ventricle and the atrium. They don't have time for each other. There's no relaxation. So this is a fast rhythm. The QRS is no greater than 3 boxes, so that's good. The P wave, you can't even figure it out. But this is a fast rhythm, and then is SVTs. This is supra-ventricular tachycardia. It's too fast. This is SVT, supra-ventricular tachycardia, faster rhythm than sinus tachycardia, right? So what do you do? There's so many causes that will happen. It's supra-ventricular tachycardia. That means supra, the definition, above the ventricle, ventricular tachycardia. So supra-ventricular tachycardia means the fast rhythm is coming from the atria itself. It's above the ventricle, supra-ventricular, right? Therefore, what do? I need to slow this patient down. But what the next anticipated plan of care? The management of SVT, the first thing you need to do is to see if the patient is very, very symptomatic or not symptomatic. If they have no symptoms, that means they have no dizziness, shortness of breath, their blood pressure is not going down. What you do is try to calm them down and then give them medication to do that. So if there is no symptoms or they are not extremists, that means extremists means your blood pressure is low, okay, you dizzy, you have symptoms, shortness of breath, you know, you confused. All those patients need immediate therapy rather than doing medication and other maneuver. So this patient, they never told me the patient have any problem, right? They never told me. All they told me is the heart rate, and she's mad at the girlfriend or boyfriend, right? What you do is vagal maneuver. Initial vagal maneuver is very good because they don't have symptoms. If vagal maneuver doesn't help, adenosine after initial maneuver fails. If that doesn't help, vagal maneuver, like let them bed down and do single carotid massage, pour ice in their face. If that doesn't help, yeah, you give them adenosine, right? Like I said, and before you start all these things, you check for symptoms and make sure patient does not have symptoms. Otherwise, you have to work faster. Synchronized cardioversion if symptoms is present. Yes, that's what you do. And when you're doing synchronized cardioversion, there's certain things you have to do. You got to put the sync mode on. So sync mode on, because you're using the same defibrillation. Every crash card has a defibrillator, and defibrillator can be turned into can be used for cardioversion. But to use it for cardioversion, you need to put the sync mode on, and therefore put the sync mode on. The patient needs sedation. You need to give them some sedation, right? You need to obtain consent, tell them that what you're going to do. And then you shock them. As soon as then you shock them, usually it's very low voltage to shock them. But synchronized cardioversion if the patient is symptomatic. Sync mode off for cardioversion. The sync mode should be on. So the answer choice is 1, 2, 3, 4. Okay, so this is a companion, like I said, just to try to teach you how to answer questions on an EKG using all this information. Okay, so that's our rhythm, number 3. And you have to know supra-ventricular tachycardia. Number 4. What do we have? Same thing, right? The anticipated plan of care will be what? That. They did not say select or apply. That means one single answer. And what is the question? A 50-year-old client on the telemetry ward was resting backwards comfortably, okay, and having dinner at the following rhythm with heart rate of 140. What is my plan? I have a patient who is just sitting down, eating, comfortable, enjoying his food, and the rhythm shows heart rate of what? heart rate of 40, but it looked fine. So his heart rate is what? 40. And then it looked fine. What would you do? And this is the EKG. You check what is the rhythm. Is it sinus? Just by looking at, you have to eyeball it. I look at it from the length from year to year is the same. So I have a sinus. And what is my heart rate? And they don't tell me it's a 6 seconds. So I have to use RR. So 1, 2, 3, 4, 5, 6, 7. So 300 over 7. This is very, very low, right? It's very, very low heart rate based on the numbers that they've given me. And it's closer to the 40 that they got. It's very close to it. So what do you think? What would a 300 divided by 7? It's like 42, right? So at 3, we are 42, which is almost close to that, 42 or 43, right? So patient is what? It's a slow heart rate. And then you look at a P, the P into 4, I can count 1, 2, 3, 4. There's 4 boxes. And a QRH, there's 2 boxes. So I'm good. This is not greater than 5, and this is not greater than 3. So I'm good. So, and there's PQRS, there's PQRS, and there's PQRS. Look at this. This is what I was telling you about the SVT. After the ventricular repolarization, look at the distance. It took a while for the atrium to fire and the ventricle fire again. And then the ventricle relaxes. It took another long time for the atrium to do contraction. There's always a pause between the ventricular repolarization to the atrial depolarization. So this took a long time. That's why the heart rate is very low. So I have a bradycardic patient who has no symptoms. He's doing fine. It's okay, right? And he's eating dinner. What do you want to do? If you do vagal maneuver means you causing the parasympathetic nervous system to take over. This will decrease the heart rate more. And therefore, this is a wrong move. If you give them a beta blocker, you're going to decrease their heart rate more. This is going to be a problem. I will check whether they have symptoms because atropine is used for symptomatic bradycardia. Therefore, I'll check. My priority function is to check whether they have symptoms. They're eating dinner. The heart rate is 40. I know it's worrisome. You're going to do something to a patient who is sitting there resting comfortably and eating dinner, enjoying themselves. It may be an athlete, and therefore there's nothing for you to do. So don't give them atropine. I know the heart rate is very low, but don't give them atropine. Atropine will increase the heart rate. Somebody who's eating dinner and sitting comfortably, that means they meet the high ball test. In medicine, we call high ball test. That means when you walk into the room, their leg is crossed, they're reading their Bible or a book, and their heart rate is 40. They look fine. The pressure is okay, everything's fine. Nothing for you to do. So for this patient, we just don't do anything. So bradycardic, if you're symptomatic, I give you atropine. If atropine does not work, it depends on also how symptomatic you are. Okay, if you have like systolic blood pressure really, really low, sometimes the best answer choice when they are symptomatic is transcutaneous pacemaker. If they are not really, they tell you they sweaty a little bit, yeah, give them atropine and that will bring it up. And if that doesn't work, you do transcutaneous pacemaker. So transcutaneous pacemaker, basically, that is the best choice for patients who are really, really symptomatic. Okay, so for this patient, slow heart rate, you see different rhythm. It's very slow. We know P and QRS are okay. It's just a long time for after the repolarization of the ventricle before the atrial depolarize. Okay, rhythm number 4. Rhythm number 5. What do we have? The next anticipated plan of action will be what? Okay. 45-year-old client had surgery, sigmoid resection after post-op day 1. That means after surgery, the following day, found to have the rhythm below. So he had surgery, and this is what we find. The patient report what? He's telling you, I'm dizzy, my blood pressure, systolic blood pressure is 80. What would you do? Then you look at it and you say, I got to do my RR interval. From here to here, if I look from here to here, it's not the same distance. This is not the same. Even this is not the same. So the rhythm is not regular. This is irregular rhythm. There's only one you should worry about: atrial fibrillation. That means the atrium is fibrillating. And if the atrium is fibrillating, I should not be seeing any P waves at all. You see, and you can see, I don't see a P wave here. I see the QRS, then I see T wave, that's the ventricle and repolarization. Then I don't see anything, whether the atrium is contraction, but it's there, it's buried. We don't see it. It's so fast that it's quivering. It's like doing like that, okay? That's what we call atrial fibrillation. It's different from ventricular fibrillation. So atrial is fibrillating. It's like shaking. It's like it's acting out. The blood is there. It's just rotating, not doing anything, right? It's a fast rhythm, right? And you have to calculate, and you can see from here, there's only one distance. So probably it's greater than, I can assume the heart rate is greater than 150. But you have to get full 60 seconds, and then you can calculate, right? But look at it. This is what we have: irregular rhythm, fast one, and I have symptoms. My blood pressure is low. So this is the same thing. We call them tachyarrhythmia, right? It's the same thing like the SVT, but it's different. The management, though, is the same. Every tachyarrhythmia, SVT, AFib, atrial fibrillation, or atrial flutter, no matter what, any tachyarrhythmia, if they have symptoms, your number one is to do what? Synchronize cardioversion. That's your best choice, okay? And so for this patient, that's what we're going to do. Vagal maneuver is not going to help with this patient with the blood pressure of 80 and dizziness. He has symptoms. It's a tachyarrhythmia. You have to do something. You have no time. So I'm not going to do this. Amiodarone may help, but patient blood pressure is 80 and dizziness. I need to do something faster. Okay? I need to do something faster. So I'm not going to choose medication. CPR, no. This is not a patient who they will be sitting there looking at you, say, why are you pushing on my chest? They don't need a CPR. They need immediate synchronized cardioversion, okay? Because the systolic blood pressure is 80 and they're dizzy, and we got to get them back as soon as possible. So put a sync mode on and do immediate synchronized cardioversion. If you defibrillate them, you kill them. Okay, so the answer is number 4, synchronized cardioversion. Okay, and so I said, if the patient has no dizziness and his systolic blood pressure is now what, 110. So I have no dizziness and my systolic blood pressure is 110. What is your plan? So the same thing, atrial fibrillation, and the patient has no symptoms. You look fine. Yeah, for this patient, medication is good. So you can give them either a beta blocker, you can give them a calcium channel blocker, or you can give them amiodarone. Amiodarone is the drug of choice. So this patient is going to get amiodarone. Vagal maneuver is not going to work. It will work with SVT, okay? The patient will not need a CPR, will not need defibrillation. They may need synchronized cardioversion, but later, if the amiodarone does not work, you have to give them amiodarone times 2. If you give me the amiodarone, the first dose is 150 and the second dose is 300. And if none of them work, then you have to synchronized cardioversion with the sync mode on. Normal 4 rhythm, normal 5 rhythm, you have to know atrial fibrillation. Another content here, if the patient has AFib, you see, I keep on saying cardioversion, amiodarone. That means AFib, number 1 treatment is rate control. Control their rate. Don't worry about anticoagulation. Anticoagulation is number 2. Later on, when you've ruled out everything, you get an echocardiogram and everything before you give them what? Anticoagulation. So when they give you a question, it says somebody is